Hey, are you dealing with tight hips? Super common to hear. Hey man, my hips, Grant, are super tight. I can't turn in my swing because they just lock up. Or I feel like I can't get through. I feel like I'm getting blocked in my swing. I can't clear. I can't get into the ball. I can't get fully into my backswing because it just tightens up on me. You might be having back pain too because of it. So all of these things are common to hear. I hear them all the time from golfers all of the time. And it's often very simple to fix. Now it's going to be dependent on you and your situation and where you're at and what you've been doing, because your hips, it's complex. Let's just say that. It's important to get assessed by a physical therapist, and if you're a golfer, specifically with someone who works with golfers, because it's important to have that connection and understanding of how it relates to your golf swing. Now, what does that mean? Because your right hip's tight, I can't get fully back. Well, what truly is the issue? Is it the hip? Is it the shoulder? Is it the spine? Is it the neck? We gotta think through these things. And the way that we go through that is we assess all these different centers and put it together as to what really is going on. So if I'm trying to get into my backswing, but I can't really get into that hip, well, what might be a reason for that? Well, maybe I'm having this swing fault that's leading to that. I'm not able to get into it. Maybe I'm locked up in this hip joint. Maybe it's the soft tissue. Maybe it's actually into the spine that I can't turn because my back is super tight. And then maybe in my downswing, I can't get through the ball. Well, maybe your hip actually is going through, but you're limited through your spine, but it feels like it's your hip because because you're not getting it from here, you're trying to get it from here, and it just feels like it's just getting stuck. So if any of those things, are happening, it's common. Let's fix that up. Let's get you assessed. But something that can help you possibly right now. Now, this isn't medical advice. Understand that. I'm not giving you treatment or medical advice here. And I highly encourage and recommend that you get looked at and assessed by a medical professional, by a physical therapist, specifically at how you specifically move to give you the best results for you and your situation. But we have a lacrosse ball. We have a muscle here called the TFL. If you have your hand here, can you feel that bone on the front of the hip? Now that's called the ASIS. Just a fancy anatomy acronym. That bone, we're coming directly below it. You see where my pocket is? That's kind of where this muscle will be. If you kind of dig your thumb or your fist into that muscle, is it tender? Does it hurt? If it does, it's not normal. If it doesn't, then great. But if it does, let's take this lacrosse ball, and you're gonna put it right there, and you're gonna lay onto it on your side. And so when you lay onto your side, it might be tough and tricky to kind of find, so make sure you kind of move it around to see if you're able to get into the spot like you need to. But working on that soft tissue there, you should notice, oh wow, my hips are a little bit looser. But working on that directly could help with that tension that you feel that's kind of blocking you. Now it can be a lot of other things, okay? The hip is complex because it's so close to the back, and there's a lot of different things that's going on in the hip. You got the joint, you got all these tissues around it, so understand that you need to get it looked at fully to get a clear understanding of what you need to do. And if you're ready to take action on understanding how to get you better, let's hop on a call and let's give you a clear path going forward to see, what you need to do specifically to get you better and to get you out of pain and playing like you want to.